I want you to do something right now while you are watching this video. Look at your hands, look at your arms, look at your stomach if you can. Because what I am about to show you in this video, the specific signs that appear on your skin, could tell you something about what is happening inside your liver right now that no blood test has caught yet. Your liver is the most silent organ in your body. It has no pain receptors. It cannot tell you when it is struggling. And by the time most people discover their liver is in serious trouble, through blood tests, through symptoms, through a diagnosis, significant damage has already been done. But here's what most people do not know. Your liver communicates through your skin. Long before any blood marker becomes abnormal, long before any symptom appears, your skin begins showing specific, documented, medically recognized signs that something is wrong inside your liver. I have been practicing hepatology and internal medicine for over 22 years, and the skin signs I am about to show you are taught in every medical school in the world. Every physician is trained to recognize them, but very few physicians have time to explain them to their patients in a way that allows seniors to recognize these signs themselves, at home, in the mirror, before the problem becomes serious. In this video, I am going to show you 7 specific skin signs of liver stress and liver disease. I will explain exactly what each one looks like, why it appears, and what it means. And I will tell you exactly what to do if you recognize any of them. Please, while I describe each sign, actually look at your own skin. Check yourself. Because the earlier these signs are recognized, the more options are available. Tell me in the comments, are you checking your skin right now? Type Y yes below. And tell me, has your doctor ever examined your skin specifically for liver signs? Most seniors say no. Before the 7 signs, you need to understand why the liver communicates through the skin at all, because this biology is what makes these signs clinically meaningful rather than coincidental. Your liver performs over 500 different functions in your body. It filters toxins from your blood. It produces bile for digestion. It manufactures most of your blood proteins. It regulates hormones. It stores vitamins and minerals. And it processes virtually everything that enters your bloodstream, from food to medications to alcohol to environmental chemicals. When the liver is under stress, from fatty liver disease, from viral hepatitis, from medication toxicity, from alcohol damage, from autoimmune disease, several specific things happen that manifest visibly on your skin. First, bile accumulates. When the liver cannot process bile efficiently, bile salts and bilirubin, the yellow pigment produced from the breakdown of red blood cells, accumulate in the bloodstream. Bilirubin deposits in skin tissue, causing yellowing. Bile salts deposit in nerve endings in the skin, causing intense itching without any visible rash. Second, hormones are not properly metabolized. A healthy liver breaks down excess estrogen and other hormones. When liver function declines, estrogen accumulates in the bloodstream, even in older adults and in men. This hormonal disruption causes specific vascular and structural changes in the skin that are among the most diagnostically useful liver signs a physician looks for. Third, toxins accumulate. When the liver cannot efficiently filter toxins from the blood, those toxins circulate longer and at higher concentrations, affecting skin cell health, color, and texture in specific ways. Fourth, clotting factors are reduced. The liver produces most of the proteins responsible for blood clotting. When liver function declines, clotting becomes less efficient, leading to easier bruising and slower healing that appear visibly on the skin. Understanding these 4 mechanisms makes the 7 signs I am about to describe medically logical rather than mysterious. Now let me walk you through the 7 signs. Please actively look at your own skin as I describe each one. Sign 1. Yellowing of skin or eyes, jaundice. Look at the whites of your eyes right now. Are they bright white? Or do they have any yellow tinge? Now look at the skin on the inside of your wrists where the skin is thinnest. Is it your normal skin color? Or does it have any yellow cast? Jaundice, the yellowing of skin and eyes, is caused by bilirubin accumulation in body tissues. It is one of the most recognizable and most serious liver warning signs. And in adults over 65, it can appear subtly. A slight yellow tinge that is easy to dismiss under artificial indoor lighting. The best way to check for jaundice is in natural daylight. Look at the whites of your eyes in a mirror near a window. Any yellow coloration, however subtle, in the whites of the eyes warrants immediate physician evaluation. A study published in the British Medical Journal found that jaundice visible to the naked eye indicates that bilirubin has reached at least 2 to 3 times its normal blood level, meaning significant liver or bile duct dysfunction is already present by the time the yellowing becomes visible. Important note, not all jaundice indicates liver disease. It can also indicate bile duct obstruction, certain blood disorders, or medication reactions. But all jaundice in adults over 65 warrants urgent medical evaluation regardless of cause. Sign 2. Spider angiomas. Spider veins on the upper body. Look at your chest, shoulders, upper arms, and face. Are there any small red spots, smaller than a pencil eraser, from which tiny red blood vessels radiate outward like the legs of a spider? These are called spider angiomas. And while a single one may be insignificant, multiple spider angiomas appearing on the upper body above the belly button is a specific and well-documented clinical sign of liver disease. The mechanism involves estrogen accumulation. When the liver is not efficiently metabolizing estrogen, elevated estrogen levels cause the small blood vessels near the skin surface to dilate and proliferate in this characteristic spider pattern. Because estrogen effects are most pronounced in areas where estrogen receptors are concentrated, the upper trunk, arms, and face. Spider angiomas appear specifically above the waist rather than anywhere on the body. A study published in the Journal of Hepatology found that the presence of 5 or more spider angiomas on the upper body was associated with portal hypertension, elevated blood pressure in the liver's portal vein system, in over 80% of cases. This is a significant finding that indicates advanced liver stress. 1 or 2 small spider angiomas in an older adult may not be alarming. 5 or more, particularly if they have appeared recently or are increasing in number, warrant specific discussion with your physician in the context of liver health. Sign 3. Palmar erythema, red palms. Look at the palms of your hands right now. Are they a normal flesh tone? Or do the outer edges of your palms and the area around the base of your thumb and little finger appear red or warm? This reddening of specific areas of the palms, called palmar erythema, is another consequence of estrogen accumulation from impaired liver metabolism. The same mechanism that causes spider angiomas also causes this characteristic reddening of the palms, specifically the outer margins rather than the center. Palmar erythema can have other causes: pregnancy, thyroid disease, rheumatoid arthritis. But its presence in an older adult without these conditions, particularly when combined with other skin signs I am describing, is a recognized indicator of liver dysfunction. The redness typically blanches, temporarily disappears when you press on it, and then returns when you release pressure. This blanching characteristic helps distinguish palmar erythema from other skin discolorations. Sign 4. Intense itching without rash. This sign is invisible, but it is one of the most distressing and most diagnostically significant liver skin signs in clinical medicine. Do you experience intense itching, particularly at night? Particularly on the palms of your hands and soles of your feet, without any visible rash, without any skin condition, without any obvious allergic cause? This itching, called cholestatic pruritus, is caused by the accumulation of bile salts in the skin when the liver is not processing bile efficiently. Bile salts deposit directly in the nerve endings of the skin, triggering an intense and often unbearable itching sensation that antihistamines typically do not relieve. The characteristic features that distinguish cholestatic pruritus from ordinary itching are these. It is worse at night. It is often worst on the palms and soles. It does not produce a visible rash, and it does not respond to typical anti-itch treatments. A study published in the Journal of Gastroenterology found that cholestatic pruritus preceded the formal diagnosis of liver disease in a significant proportion of patients, appearing months before any other symptom or blood test abnormality. If you have been experiencing unexplained itching that fits this description, particularly nighttime itching of the palms and soles without visible cause, bring this specifically to your physician's attention in the context of liver health. Sign 5. Easy bruising and slow healing. Look at your arms and legs right now. Do you bruise more easily than you used to? Do bruises appear from minor contact that should not cause bruising? And once they appear, do they take unusually long to fade? Easy bruising in older adults has multiple causes, including blood thinners, aspirin, and the natural thinning of skin with age. But a specific pattern of easy bruising that is new, progressively worsening, and not explained by medications or known causes can indicate declining liver function. The mechanism is reduced production of clotting factors. Your liver produces most of the proteins your blood uses to clot, including factors 2, V, VIA, IX, and X, and fibrinogen. When liver function declines, these clotting proteins are produced in smaller quantities. Blood takes longer to clot. Minor injuries produce larger bruises. And those bruises take longer to resolve because the healing process also depends on adequate clotting factor levels, a clinical assessment tool used by hepatologists called the INR or International Normalized Ratio, directly measures clotting factor function as an indicator of liver synthetic capacity. An elevated INR is one of the most sensitive markers of liver dysfunction. And the skin manifestation of this is exactly the easy bruising pattern I am describing. If you are not on blood thinners and you have noticed a progressive increase in easy bruising, ask your physician to include NR and liver function tests in your next blood work. Sign 6. Changes in nail appearance. Look at your fingernails right now. 2 specific nail changes are associated with liver disease in older adults. The first is called Terry's nails. The nail appears mostly white, with a narrow pink or red band at the tip. Not the normal pale pink of a healthy nail, but an unusually white nail with only a small strip of normal color at the very end. Terry's nails indicate low albumin levels, albumin being a protein produced almost exclusively by the liver. When liver function declines, albumin production falls, and this characteristic nail change can appear. The second is called clubbing. The fingertips appear enlarged, and the nails curve downward over the tips of the fingers, like an upside-down spoon. Nail clubbing has multiple causes, including chronic lung disease and cardiovascular disease, but it is also a recognized sign of chronic liver disease and cirrhosis. A study published in the Archives of Internal Medicine found that Terry's nails were present in a significant proportion of patients with chronic liver disease and were associated with lower albumin levels, directly correlating with declining liver synthetic function. Check your nails in good lighting. If your nails appear predominantly white with only a narrow, normal-colored band at the tip, or if you notice any enlargement or downward curving of the nail tips, mention these specifically at your next physician appointment. Sign 7. Darkening of skin and body folds. The final sign requires you to look at the skin and the folds of your body, the back of your neck, your armpits, the area under your breasts, your groin area. Is the skin in these areas noticeably darker than the surrounding skin? Does it appear brown or velvety in texture? This darkening, called acanthosis nigricans, is most commonly associated with insulin resistance and diabetes, but it also appears in the context of non-alcoholic fatty liver disease, which is now the most common liver disease in adults over 65 in Western countries. Non-alcoholic fatty liver disease, NAFLD, affects approximately 30 to 40% of adults in Western populations. It develops when excess fat accumulates in liver cells, driven by insulin resistance, obesity, metabolic syndrome, and dietary factors. In its early stages, it is completely asymptomatic and undetectable without blood tests or imaging. But acanthosis nigricans on the skin can appear as an early external marker of the metabolic dysfunction, insulin resistance, and liver fat accumulation that underlies NAFLD. A study from the American Journal of Gastroenterology found that acanthosis nigricans was significantly more prevalent in adults with NAFLD compared to age-matched controls without liver disease, and that its presence was associated with more advanced stages of liver fat accumulation. Now the most important part, what to do. Step 1, do not panic, do not dismiss. Recognizing one of these signs, even several, is not a liver disease diagnosis. Many of these signs have multiple possible causes, and some, like a single spider angioma or mild easy bruising, are common in older adults without significant liver disease. But recognizing a pattern, multiple signs appearing together or any single sign appearing suddenly and progressing, is information that deserves formal medical evaluation, not panic, not dismissal. Evaluation. Step 2, see your physician and be specific. Do not say I have been having some skin issues. Say I have noticed these specific changes, and name them by the descriptions I gave you in this video. Spider-like blood vessel patterns on my upper body, unusual redness on my palms, yellowing in the whites of my eyes, intense nighttime itching without a rash, unusual nail whitening. The more specific you are, the more efficiently your physician can assess whether these signs warrant liver-specific investigation. Step 3, ask for liver function tests. Ask specifically for a liver function panel, also called liver enzymes or LFTs. This includes ALT, AST, alkaline phosphatase, bilirubin, albumin, and total protein. Together, these tests give a comprehensive picture of liver health that a standard annual blood panel may not fully capture. Also ask about a FIB-4 score, a simple calculation using age, ALT, AST, and platelet count that estimates the degree of liver fibrosis. Scarring, with reasonable accuracy and no additional cost beyond standard blood tests. Step 4, Address modifiable risk factors. The most common cause of liver disease in adults over 65 in Western countries is non-alcoholic fatty liver disease, driven by metabolic factors that are directly modifiable. Reducing refined sugar and refined carbohydrate intake, reducing processed food consumption, achieving and maintaining a healthy weight, managing blood sugar and insulin resistance, increasing physical activity. These interventions do not just slow the progression of existing liver disease. In early stages, they can allow the liver, one of the most regenerative organs in the body, to meaningfully recover. Your action plan. 4 steps starting today. Action step 1. Right now, after this video ends, do a complete skin check in good natural light. Look for the 7 signs I described. Yellowing of eyes or skin, spider angiomas on upper body, red palms, nail changes, skin darkening and body folds. Write down anything you notice. Action step 2. This week, ask your physician to include a full liver function panel in your next blood work if it has not been done recently. Ask specifically for ALT, AST, alkaline phosphatase, bilirubin, and albumin. And ask about a FIB-4 score calculation. Action step 3. Starting today, reduce 1 liver-stressing dietary factor: processed food, refined sugar, excessive medication, particularly over-the-counter pain relievers like acetaminophen and NSAIDs that are directly processed by the liver. 1 reduction, sustained consistently. Action step 4. Share this video today with your family. Ask them to check their own skin, because the people most likely to notice these signs in us, particularly subtle ones like palm, redness, or nail changes, are the people who see us regularly. Make liver skin signs something your family knows to look for. Your liver works for you every single moment of every single day. Filtering, processing, manufacturing, protecting, without any sensation, without any complaint, without asking for anything in return. And when it begins to struggle, it speaks through your skin in signs that medicine has documented for over a century. Signs that every physician is trained to recognize. Signs that you now know how to recognize yourself. Do not ignore what your skin is trying to tell you. A yellow tinge in your eyes, spider vessels on your chest, red palms, nighttime itching, white nails. These are not random. They are messages. And the earlier you receive and act on those messages, the more your liver can do what it does better than almost any organ in your body: heal itself. If this video gave you something genuinely valuable, if it made you look at your skin differently today, please subscribe to this channel. Every week I bring you senior-specific, clinically grounded health information that fills the gap between rushed appointments and the knowledge you deserve. Hit the like button if this video made you check your own skin. Leave a comment below. Did you find any of these signs? I read every single comment.